Hi, and welcome to MedInsights Unleashed podcast. I'm John Collins, and I hope you enjoyed this new episode, and thank you for listening. Welcome to MedInsights Unleashed. Throughout this podcast, we've explored innovations in medicine, diagnostics, new therapies, and patient care. Today, we're taking a step back to ask a much broader question. Can the communities we build become part of the healthcare system itself? My guest today is someone I've known for many years. I first worked with Pascal during our time together at Roche, where he had senior leadership roles before embarking on a remarkable journey into sustainability, urban development, and preventative health. Today, we explore how our cities' access to nature and environments in which we live may influence physical health, mental well-being, and even longer-term disease prevention. Pascal, welcome to MedInsights Unleashed.
Thanks, JC. It's a real pleasure to be here, and I'm thrilled to be talking about the power of nature in health and in cities. So looking forward to getting stuck into it.
That's great. And this is a whole new topic for me, so it's a really learning curve. So I want to thank you for that, and I'm sure it's going to be a learning curve for our listeners as well. Pascal, you've worked in over 30 years in the industry, pharmaceuticals. You've been in 10 countries, major roles in these three industries. But you had one defining event that actually transferred you from the pharmaceutical industry into urban development. What was the situation that occurred there?
Yeah, actually, JC, it was a bit of a slower burn than just one moment, but it did have one sort of culminating moment for me. So I was very grateful, very happy, very honored to be working for Roche and working on all the exciting therapies and medicines that we were launching. But I was sort of, around the time I turned 40, I was living in Italy, and I became increasingly frustrated with the activities that we were doing and my perception that there wasn't a connection to sort of some of the root problems that might be causing a lot of the illnesses and diseases that we were tackling. And so I became increasingly interested in climate change and in sustainability. And to reference the moment that you might have mentioned, so every morning, I lived in Milan for many years. Every morning I would leave my town and drive my kids to school and basically drive into a thick fog of air pollution. And you, JC, might think of Milan as the capital of fashion and culture and art. Unfortunately, Milan is also the capital of some of the worst air in Europe. And so I really felt that. I looked at my kids in the rearview mirror and I thought, this doesn't feel right. I should be doing something more active about this. And so I decided to move into a new industry and try to use the skills, that business acumen I developed working for 20 years in healthcare, and orient it into this new space in sustainable development.
That's an amazing story, and it's something that I think we all look at when I drive from New Jersey into New York City. You know, it's an amazing change that's happening in the cities. You mentioned to me in our previous discussion, Boston's green areas moved from about 40% down into 19%. So these urban development changes are quite significant. You work with a company called Lend-Lease, and what you were doing, especially around the London area and the Olympic Village.
Yeah. So, JC, perhaps before I jump into that, let me just give you some amazing statistics around what's happening in the world of urbanization. So we are in the midst of the greatest migration ever experienced in human history. Billions of people are moving into cities. In China alone, in the last generation, 500 million people moved from the country to the city. We are paving over the equivalent of one new New York City every 12 weeks. Africa is going to have, dozens of new cities that don't even exist today. And so we really are in this very intense trend. And sometime in the next couple of decades, roughly 3/4 of humanity will live in cities. So getting cities right is one of the most important things we can do in terms of sustainable development. And crazily enough, the way that we're living in these cities often is, very unhealthy and also even deadly. So just to give you a couple examples, urban heat in cities is now the biggest natural disaster killer in the US. So more than hurricanes, fires, everything else combined, more people die from urban heat. And that's because the asphalt and the concrete just soaks up the heat, creates what's known as the heat island effect, and it's deadly. And the same is true for air pollution, for example, JC. So most of us are exposed at some point every day to fine particle pollution that's well above what the World Health Organization deems to be healthy.
So when you talk about an urban city, are you talking about the city heart, or are you talking about city heart and the surrounding outer suburbs as well? So I think there's two things that are going on there, because when we talk about the urban area, people think about houses and trees, but then you've got the urban city, which is no trees, high buildings, a lot of glass, and a lot of
Yeah, I'm actually
reflection.
talking about both. So I'm talking about
Right.
Dallas, Houston, Phoenix. I'm talking about Shanghai, Mumbai, Mexico City, incredible mixtures of the two things you've said. So very dense downtowns, concrete, glass, cars. But I'm also talking about just relentless urban sprawl, which is a very inefficient way for us to be. So lots of freeways, not a lot of public transit, real struggles to sort of optimize how people are living in those cities. New York City actually is quite an efficient and sustainable way to live. New Yorkers have among the lowest carbon footprint per person in the US because they don't drive much, they use public transport, they walk. And so I but both those things are true. All cities I'm mentioning have some combination of these challenges around air pollution or heat or water management or whatever it is.
So how does the change occur then? And what is it that you're doing that's creating that change to the environment, cause big changes in urban planning,
I
right?
hope so. Yeah, I really
You
hope
know,
so. So I think maybe we could break it down into, a number of different areas and then, look at some examples. So let's start, for
yes.
example, with water. Specifically, let's have a look at what happens when it rains in a typical city around the world. So when it rains, the water lands on the asphalt and it collects all the dog poo, all the, benzene, all the pollutants, and it flows into the sewer system, which ultimately ends up in rivers, which ultimately ends up in the ocean. And it's now the fastest growing source of pollution in the oceans for us. So cities and the way they manage their water runoff are among the most polluting things that exist for our rivers and oceans. And a matter of fact, in the US, more than 700 cities are under an EPA consent decree. I mean, they're they've been fined. They've been told you need to find a solution for this. And for many cities, it's a huge issue because it's not just raining the way it used to, JC, when we grew up. It's raining, we're now having once in 25 or once in 50-year rain events. We're having them every 2 or 3 years. The system is overwhelmed and the pollution is overwhelming.
Seems to be even more frequent than that, Pascal. If we looked at the last couple of weeks that's happening in the United States, and France, etc., it's an incredible
Indeed. So
change.
now, yeah, you're
And it's
referring to, heat and, people are dying and people are dying in increasing numbers. And the thing that I'll point out is it's very connected to nature, which we'll talk about in a bit. So where there is less nature, people are much more exposed and especially fragile or elderly people. And so it's a real issue.
Let's get back to
Yeah.
the water. I mean, we're having major storms now all the time, and there's been major flooding across the United States, just as an
That's right.
example, right? Because it's happening in China, etc. Just, to add to your question, what's the water? What are we doing to prevent that
Well,
poo?
a really exciting, effective, and cost-effective way to manage some of this water pollution uses nature or green infrastructure to manage it. So there's a concept out there called sponge cities, which is essentially the notion that you don't make the pavement impervious, you make it pervious, right? So water is able to sort of flow through and then collect in a much more predictable and filtered way. So picture, JC, a sidewalk, a gap in the sidewalk, and then a series of plants, which could be, shrubs and trees. And so stormwater flows into that. It's called a swale or a bioswale. And the water flows through the earth, flows through the roots, and what ends up in the water runoff, the sewage system, is much cleaner and much more predictable water. And so if you start thinking of a city that has huge networks of these swales, you can see how effective this is. And maybe the most exciting city in the US for this is Philadelphia. So Philadelphia has a big stormwater pollution issue, and the water department did a big study on how do we manage this. And one alternative was to build a $10 billion series of underground pipes and pumping stations and cisterns. And it was going to saddle the city with tremendous debt for many years. And so instead, what they started exploring is, what if we design these swales all over the cities, in playgrounds and parking lots, on the roofs of buildings? And so Philadelphia now has 1,000 urban acres of green space that's designed to manage stormwater runoff. And it's called Soak It Up Philly. That's all over the town. And the city wants to do 9,000 more acres. So 10,000 acres, and manage all of its stormwater runoff using nature. And it's a really cost-effective and effective way to deal with these increased rain events that we have every year.
So we're talking about specific plants and trees that actually filter out.
Yeah, you'll hear that that's a theme of this conversation. So it's not just, you're not just planting flower beds. It's not just any old plants. And there's a real science behind how you design a swale, what kind of bushes and roots and earth you have in there, and the kind of maintenance that it needs as well. You can't just leave it unattended. So there is obviously work and new thinking that is dependent on it, but there's a real science around which plants offer that sort of service. But it's really exciting, JC. Think of a playground that, for 2 weeks is just dry and kids are playing in it. And then when there's a heavy rain event, that playground literally floods. It might have a foot of water in it, and slowly
Yeah.
that water trickles down and then goes through the water system in the city. And it's much cleaner and much slower, and it's much more predictable what you're doing. So it's really an engineering, masterpiece. It's amazing what nature can do.
How do the architects and how does the governments actually build this infrastructure, and what makes it
Yeah.
change? Is it the power of
Yeah,
one?
it is. So I mentioned Philadelphia earlier in in the Soak It Up Philly plan. I've had the privilege of traveling all over the world. I've met mayors in China and Latin America and India. And guess what? They all have the Philly Water Project description on their desk. And so cities are very actively copying each other. And there's a tremendous amount of collaboration between cities. They have fabulous networks where mayors get together and share these initiatives. And it's really refreshing. It's very different from the current trend of governments, being increasingly isolated and blaming each other for things. Mayors just get stuff done, and it's really gratifying to watch the collaboration. So many cities are now copying the Philadelphia model, or many Chinese cities, which are called sponge cities, are now being looked at and studied for other cities all over the world.
So you were mentioning that you've got data. I mean, obviously from our backgrounds, we always want to see data. Has there been a significant reduction in the diseases that patients or people have had? Because we really want to do the reduction before people become patients.
So the specific stats I have, JC, are more around air quality. So if we can revisit
Yep.
that with air quality or mental health, the example I wanted to give with using nature to manage water is just to highlight sort of the incredible engineering ability that natural infrastructure can offer as one of the ways that we can deal with stormwater. W- when you think though that, about 20,000 people fish every week in the Anacostia watershed around Washington, D.C. They fish for food, right? And the fish are sick because of all the pollution. And so the cleaner we can make that water, it has all these incredible healthy ripple effects down the line. So, but if it's okay, let's talk about air quality next and really get into some of
Yeah,
the
sure. I mean,
stats.
it's a good
Yeah.
segue, right?
I mentioned water and water pollution. One of the other important things is air quality. Now, JC, imagine, a school or a neighborhood that's right next to a freeway, of which there are thousands all over the world. And, the rates of asthma, I mentioned heat, and I mentioned other, cardiovascular diseases. We're talking about fine particle pollution, right? So you have the parts per million, you know, 10, and parts per million 2.5. Parts per million 10 is what your nose hair is filtering out, when you breathe it in. It's when a car accelerates or a train hits the brakes, like all this fine particle pollution comes out. Parts 2.5 per million are so tiny that they are the equivalent of a dot on a human hair. And you're breathing that in, it's going straight through your lungs, straight through your bloodstream into your heart. And it's responsible for, a dramatic uptick in cardiovascular disease. And so, living in a air polluted area is extremely unhealthy and also deadly. And the absence of nature is one of those indicators as to how deadly and how unhealthy it is. So what is one of the ways that, you can combat that? Well, here again, I worked with my colleagues in the medical field and in the conservation field, and we realized that nature can play a really important role in improving air quality. And so there's a lot of science involved. It's the right kind of trees in the right neighborhood acting to filter out air pollution. So, for example, we worked with schools, and if you design a barrier of evergreens followed by a series of other trees and bushes where the leaves then filter out the fine particle pollution, you can reduce air pollution in that school by 50% compared to what's on the road outside. So, JC, don't get me wrong. It's not any tree in any context. It's the right trees in the right context that we're talking about here.
Right. So EPA, you mentioned EPA, there's a lot of government discussion globally around the cost of doing the air management and quality because, that's been a decision that's being made globally. What's the outcome that can change the idea? First of all, we were having a lot of discussions about EPA, but now there's not so much. How do we reverse that?
Well, a little bit like a pharmaceutical clinical trial that many of your listeners will be familiar with, we are doing lots of work to demonstrate both sort of the clinical efficiency and the cost effectiveness of, a nature intervention. So one of the best examples I can give you is a large study called the Green Heart Study, which was based in Louisville in Kentucky. It's a 10-year study. It was done with the Nature Conservancy, the University of Louisville, a very charismatic, wonderful, medical leader, Dr. Aruni Bhatnagar. And we planted 8,000 trees in a neighborhood, a very air polluted neighborhood. And we started comparing the health of the people in the greened up neighborhood to an adjacent non-greened up neighborhood. And the results speak for themselves. There's a dramatic improvement in, high sensitive C-reactive protein, which is a really important biomarker for inflammation and heart disease. Everyone saw dramatic improvements in air quality where there were, tree barriers and tree filters. And so it's the first pharmaceutical trial where nature is the pharmaceutical. And I really urge your listeners to look up Green Heart study in Louisville, Kentucky. And again, many other cities are aware of this and are copying this strategy as a way to improve health outcomes for people living in those greened up neighborhoods.
Is there publications other than the Louisville greenhouse study? I know that you do a, not only are you a leader in this area, books or other types of data that people can look up before they become patients?
Yeah, I mean, this is about citizens and neighborhoods taking control of their environment. Next time you walk around a big mall with, a gigantic car park that has no nature whatsoever, I want you to feel anger and outrage. And I want you to feel like, hey, there's something we can do. And you're right, there is increasing amount of really interesting science happening. Another scientific study I was involved in through another organization called Nature Sacred is at Walter Reed, the famous hospital where the presidents go to have their,
Yeah.
their health checkups. And so at Walter Reed, we designed a 4-acre fallen warriors park for veterans. We designed it with veterans and for veterans. And the whole point is to get people out into nature, have these deliberate nature experiences, sit down in nature and journal, and then measure whether you can wean yourself off some of the many, anti-anxiety or PTSD medications that you might be on. And, the stats here, JC, are if you walk through a deliberately designed green space like the one at Walter Reed, your cortisol levels drop much more than they would than if you just walked around sort of a regular neighborhood. Your heart rate variability drops. Like there's really exciting science emerging to back up something that most of us sort of know. It makes sense to spend 20 or 30 minutes deliberately in nature, right? And so can I just
Yeah.
introduce a book specifically about that I think your
Yeah,
listeners
go
might
for it.
might
Yeah.
really be interested? So it's a
Yeah.
book called Nature and the Mind by Mark Berman. And Mark's expertise is calculating the health economics of being near nature. And, one of the interesting outcomes is if you have a certain number of trees in the vicinity of your house, it's a little bit like receiving a $10,000 check for health care or improving your health care by roughly $10,000. And, we need more and more of these studies to get people to understand just how effective and also how cost effective it is to have nature.
It's amazing that we're discussing this because really the parks are being reduced, right?
Yeah,
That's the sad
indeed.
part of this,
As I mentioned, the
you know?
pressure to urbanize our world is so high because more and more people are moving into cities that sort of the opposite of what I've just been describing is actually happening. There's
Yeah.
another really fascinating book I think your listeners might enjoy. It's called Last Child in the Woods by Richard Louv. For me, this was a really important book. Did you know, JC, that most kids today in the US or in Western Europe spend up to 8 hours a day on a screen or a device, but less than
Yes.
30 minutes a week of sort of unstructured nature time. And, Richard Louv coined the term nature deficit disorder. We weren't designed for that. And it's having real impacts, mental health impacts and physical health impacts. And the book is just full of incredible studies and stories on what happens when you deprive children or young people of nature, and then what happens when you reintroduce them into nature, all this sort of amazing benefits. And
Is there, I mean, there's such pressure though, even on kids with social media, right? And they're talking about banning, iPhones in schools now to get them off the phone and to get them out. I mean, obviously, this is going to take time, but there is so much pressure to really be in that swing for the social
Yeah,
media and hours. And then there's the iPad
that's
babysitter,
right.
right? So, you go out to dinner and you see the
Yeah.
kids looking at their iPad.
Well, JC, you and I are from a generation where, we
Different.
grew up a little bit wilder, my mother used to say to me, everyone out of the house and I don't want to see you till it's dark. Your mom probably said the same.
Yeah.
Today, today
Oh, yeah.
you'd get arrested for saying that. It's considered outrageous to, not know where your kids are. And so in many ways, we've brought this on ourselves. And so, a big part of I guess, my motivation to speak to you is to try and convince people to learn about what nature can do. And since your audience is such a medical and scientifically based audience, to understand that the science is crystal clear on, what happens when we're deprived of nature and then what happens when, nature's reintroduced into our lives. And especially physicians, right, JC, spend so much time deprived, or medical staff, physicians, nurses, hospital administrators. And a lot of the work I'm doing with Nature Sacred is bringing nature into hospitals. It's good for patients, they recover better. It's good for the families who wait for their loved ones in hospitals, and it's great for medical staff. Spending time in nature avoids burnout. And so we have a whole series of tools available developed by Nature Sacred that can help personnel understand the benefits of designing a green space somewhere in the hospital and what it'll do to the staff there. So a lot of data is available, and it's just not enough people know about it. Everyone's still sort of doing what they learned, in 1970 and 1980.
You bring up, the idea of pressure and long working hours. I know that my son is doing 16 hours a day. So when you're doing 16 hours a day in a hospital, yeah, and all the doctors and nurses that I know are spending longer and longer hours because the staff cuts, etc. You get, not only do you don't get time to get out in the greens, but you don't even get time to
Yeah,
really eat properly.
I know. And that classic
And
picture
so
of a nurse or a doctor sitting on the stairs, the concrete stairs of their hospital, having a bite to eat for 10 minutes before rushing back in. And so it's not a winning formula. And so that's the beauty of nature in our built environment, JC. So it works, to solve big issues like water management. It solves, local issues like air quality in your neighborhood. And it solves very personal challenges like being a nurse or a doctor or someone in a hospital and just having, 15, 20 minutes of just downtime and what it does to your nervous system and how it prevents burnout. So, the more people are
I was
interested in this, the better, because it's just a tiny fraction today of the potential of what nature can do.
I was talking to a really good friend of mine in London just recently, and he was telling me that you need to take your shoes off and then put the grass between your feet. And he said, if you do that every day, you get you improve. Everything
Yeah.
comes down. I mean, that's a big change in someone's
It is,
psyche,
JC.
right?
And, you and I grew up in a corporate culture. Not only did we wear a suit and tie, which people don't do necessarily today, but we also, for us, it was meeting rooms and conference rooms and our own offices. And I think one of the things I would argue for is you can have a great meeting while walking with someone through a park. You can, and take your shoes off for 15 minutes and, give permission for your staff to do that too. And, you can design this sort of nature-based mindfulness into your life. So if I work with a lot of, CEOs and coach them on their business challenges, many of the challenges come back to when you look at someone's daily calendar, it just goes from 7 to 8 to 9 to 10, all the way. And there's
Yeah.
no break in there. And nobody functions well never having any kind of fresh air or natural light or a connection to a plant. And so I'm always encouraging my colleagues to say, you have permission between meetings or with your staff to walk outside, hold a meeting outside, or design some kind of green space in your hospital where you can do that sort of stuff. So there's no doubt it has like an instant benefit to us in our daily lives.
So you're the board chair for Nature Sacred. What what does Nature Sacred do? I mean, you're talking to these CEOs. What's the evidence that you're giving them to what we're talking about to
Right.
make that change in their
Yeah,
staff?
Nature Sacred is a fabulous organization. So Nature Sacred Bill is a growing network of green spaces designed in urban areas or in healthcare facilities with the goal of, improving people's health and wellness through access to nature. Now, JC, you should know that many parts of the world, but let's talk about the US for now. There are many parts in every city in the US that have almost no access to nature. Pick any city, pick Baltimore, pick Philadelphia, pick New York. There are areas where it's just, you know, there's no access to nature. And so we very specifically design green spaces in order to give people who have very limited access to green space the ability to enjoy the benefits of what we've just been talking about, right? So cooling and calm and peace. And what's really lovely with Nature Sacred is we design these special benches that are part of the park. And in the
Huh?
bench, under the bench, is a waterproof journal. And people write the most, heartfelt, wonderful things in these journals. And it's such a testimony to what they're experiencing right there in that moment, this break from the chaos out in the city. And we've collected all the journals and we've printed some of them, and they're just the most, heartwarming, real reactions to what happens when you take a little bit of time out from kind of the chaos outside. And we also build green spaces in hospitals. We design special green spaces so people in wheelchairs can get around them, or they do yoga in a green space. Or it's just amazing what happens when Nature Sacred designs these deliberately designed green spaces in a neighborhood, in an area, and what happens to the community and what happens, to the healthcare community when they have access to something like this. It's really special.
That's amazing. They say all roads lead to Rome. I mean, obviously, when you go to Rome, and for all our listeners, anyone that's been to Rome or big cities, is basically we should say all trees need to go
Yeah.
to Rome. But it's a lot of these cities are actually
Yeah, now
treeless.
remember, JC, many of Rome was designed, more than 2,000 years ago, and it didn't have
Yeah,
stormwater issues and they didn't have fine particle pollution the way we do now. So our society, our civilization has outgrown the way we designed our cities, no doubt. And you're right. Many old cities in Italy, for example, have no trees at all in them because they didn't need them at the time. It was sort of nature's out there, our cities in here, and they didn't need nature the way we do now. And they spent a lot of time outdoors anyway. They weren't working
yeah,
in operating theaters or in front of a PC in an office with no windows, right? So, but it's a
uh,
very solid observation. Most of our cities were designed in a time where, you know, the issues that we're facing today just weren't top of people's minds.
well, hopefully this episode will definitely bring it to the top of mind. So, how does the future hold, Pascal? Where are you going
Mm.
to with your plans? And for those CEOs that you're talking to, what's the future look
Yeah,
like?
it's a mixed bag in the sense that, the intensity and the drive to urbanize is happening at such a rapid pace. And it's easy to do business as usual. You just build a tower made of, concrete and glass and steel. You design a car park and you move on to the next thing. And I think what my colleagues and I who work in sort of this urban nature space are asking is we need to rethink things like density. We need to rethink, transport. We need to rethink the way we eat. all of these things are connected, and nature is like this perfect summary of all of those things. And at the beginning of this podcast, you mentioned Boston, a city that used to have, 40% tree canopy and is now at 19%. And, nature is often the thing that's remembered last by the city planners or by the urban planners who are facing these tremendous challenges of like housing. How do we get more people who want to live in Boston to live in Boston? Well, let's build a bunch more houses the way we know how to do it. And so then the risk is that you design exactly the kind of neighborhoods that, you know, create the sort of health issues that we've just been talking about. And it's a real kind of it's really hard to do because the pressure on urbanization is really intense.
One of the things that I noticed in New Jersey when we arrived here in 2000, sorry, so I've been here 25 years. We're sort of blessed in certain regards here because all the trees around the houses, it's quite amazing. Obviously, when there's big storms, we've got the wrong trees because they fall over too easily. But the thing is that that's a blessing, but you're right, it's going to change. And one of the biggest changes I've seen is
Yeah,
Sydney.
exactly.
When I go back into Sydney, there's all these massive high-rise buildings, and there's no
Yeah.
green space now. It's
Yeah,
diminishing.
your home country of Australia is on the real forefront of that, and Sydney's a great example. I think your instinct, which is, well, we're building, very sort of, tight and we're building vertically. But if that isn't thought through, all you have is, 5,000 people in a building with zero access to nature. I'm not, Australia's other big city, Melbourne, the center of Melbourne is fabulously green, Collins Street and Albert Park.
Yes.
But Melbourne is
Yeah.
now, 100 kilometers sprawl out into the suburbs, as is Sydney, by the way, right? And the further west you go, the hotter it gets, the less dense it gets. And people out there are experiencing, weeks of 35 or 40 degrees Celsius weather, and it's unlivable. And so, building a big house to the edges of your property without any nature isn't helping at all.
It should be plant the right tree,
Yeah,
not just
exactly.
trees.
Thanks for teeing that up. This is really important. So nature can't solve all urban problems. I'm not saying that at all. And like with anything, you need science and data. And so, when it comes to trees to help with air quality, we can help cities and mayors decide which trees in which neighborhood are solving which problem. And you can't just plant, a bunch of evergreens and hope for the best. It's got to be this real sort of strategy of what your trees are designed to do that involves the wind, that involves traffic, that involves, either creating a barrier and then having other trees and bushes that filter out the fine particles. So there's a real science behind it. And it's really exciting to know that we have that knowledge and we could be solving that.
So we're coming to the close. My usual question is, if you had to summarize our discussion today in 3 points, Pascal, what would be the 3 key messages you want people that are listening to this episode?
Yeah. So the dearest thing to my heart is now that you've heard this podcast, you can't unhear it, right? And so the first thing I really want people to do is when they're walking around a neighborhood, I want them to look around and see, is there nature here? Is there nature helping us solve a problem, or am I literally in a part of town where there's a complete absence of nature? So realize what's going on. The second thing I would love for people to do is to understand that it doesn't have to be like that. Like, that's old thinking. The benefits of nature are so overwhelmingly positive that this is a moment to get involved. Call your representative, call your mayor, call your counselor, and talk about the strategy that nature can deliver. And the third thing I'd like for everyone to know is, once you feel that, just, understand the incredible power that nature has in solving some of our really basic everyday issues, making our our lives more resilient, more livable. And, get involved in your local tree planting group, get involved as a physician, and understanding what nature's going on. I think the last thing I'll say, JC, today in the US, your zip code is the number one determining fact of how healthy you're going to be. And when you fly over a city and you look down at a certain zip code and there's a lot of tree canopy, chances are those people are wealthier, healthier, and so on than areas where there's no trees. And so it's also really about equity and equality and democracy. Nature is an indicator of what is going on the ground. And that's another thing I would love for people to recognize. You and I live in neighborhoods that are full of trees, and that's just this incredible benefit that we have, and we walk around sometimes not even appreciating it.
And you bring up a really good point. So how the people that are working in areas where they're treeless, right? They really need to put pressure on us planting those trees.
Yeah.
And the last thing I want to add is taking their socks and shoes off and putting their feet into grass, right? It's very calming. It's just so good.
Watch for splinters and nails, but
yeah, we don't want a medical emergency due to that.
You're
that's
right.
For sure.
It's a fabulous metaphor for, getting out there and for immersing yourself in nature and, have a forest bath every day and see what it does to your nervous system. A forest bath. That's a real term, JC.
What?
And it's
Is it?
Well, it's actually a Japanese concept, but it basically means get out in nature, have a bath, be bathed in a, surrounded by trees or by a forest, and see what it does to you. So there you go. Yeah.
It's a good point. Well, Pascal, I want to thank you on behalf of the MedInsights Unleashed listeners. It's been a fantastic way to look at health in a whole different area, and which we've never done before. And it's totally been refreshing to really visit it and be more proactive and preventative by actually changing our environment and improving our health before we even become patients.
Exactly.
So on behalf of the team, I want to thank you very, very much.
Yeah,
Pascal.
my pleasure. Thank you.
Is there a way that people can reach out to Nature Sacred?
Absolutely. Naturesacred.org is the best way to do that. And if you like, JC, I can send you all of that information in the link. But naturesacred.org is the official website.
Well, that's fantastic. And I recommend that all our listeners go to naturesacred.org and reach out and see how you can change your community to a better way of being healthy.
Yeah.
So thanks again, Pascal, and thanks again for everybody listening on this episode.
Cheers. Bye-bye.
MedInsights Unleashed disclaimers. This podcast is for general information purposes only and should not be considered healthcare advice in any way. The podcast is not intended to replace professional medical advice. The use of the information and material linked to the podcast is at the user's own risk. MedInsights Unleashed is not responsible for any losses, damages, or liabilities that may arise from the use of the podcast. Importantly, please consult your healthcare provider for individualized guidance and treatment. Thank you, and we look forward to you being with us on the next MedInsights Unleashed podcast.